Hello friends, welcome to the video on the topic discussion combined hormonal contraceptives or combined oral contraceptive pills, commonly called as. So if you are a student of MBBS and you are going to give your exam, viva exam in either obstetrics or in PSM, then this topic is of importance because it may be asked about you in viva, especially in table viva. So you should be aware about this. Also, if you are going to practice in your life, then also this topic is important because you should be aware about this, as women and men, they will come to you asking question about this topic. So a brief history: it was introduced, the combined hormonal contraceptives were introduced in 1956 by Pincus. So this may come as an MCQ in your exam, remember this. Now what are the two components of combined? They are combined, right? I am talking about combined oral contraceptives. So what are they combined of? They are combined of both estrogen as well as progesterone. Okay, so estrogen is invariably ethinyl estradiol in all the brands which are available in the market. There are hundreds of brands available. They all primarily depend on the progesterone component. Different generations of progesterone, first generation, second generation, third generation, they are used. Why? Because progesterone which were used earlier, they had androgenic properties also. So to always there was a research going on to find progesterone that are of less androgenic property, and that's why we have the first generation, second generation, third generation, and so on. In India, Mala D and Mala N, they are provided by Government of India free of cost from the PHCs. So what are the components of Mala D and Mala N? This is a very favorite question of examiners in viva. So ethinyl estradiol, you know, this is the estrogen component. Now what about the progesterone? Mala D contains 0.5 milligram D-norgestrel, okay, and Mala N contains norethistérone 1 milligram. There is one more difference in between the two. Mala N does not contain the hormone free pills that are present in Mala N. They do not contain iron, but Mala D contains those pill free periods. The 7 pills that are not containing hormones, they contain iron in case of Mala D to prevent anemia as well. So these are the two differences. This may be asked in your viva and you should be prepared for it. So now we say that there are 3 generations of oral contraceptive pill depending upon the progesterone component in it. So the first generation, they have this norethindrone and its derivatives. This is the first generation. They were first of all introduced in the market. Now because of the androgenic effect of this norethindrone, better levonorgestrel and its derivatives were then used in the second generation, and the third generation, they do contain desogestrel and norgestimate. So these are having very less androgenic properties, and they are most commonly used to prevent the polycystic ovarian syndrome and related acne condition along with it. So this is the difference in the 3 generation of combined oral contraceptive pills that are available. This is a very favorite question. You may be asked what is the first generation, second generation, third generation difference. You have to tell that it is the difference in the progesterone that is being used in it. So these oral contraceptive pills, they are usually used in a 28-day cycle period. 28-day cycle period. What we do, we give 21 days medicine which is containing the hormonal component, and 7 days they are pills, they do not contain the hormonal drugs. So this is a 28-day cycle which simulates the normal menstrual cycle. But as the nowadays women, they are more worried. They don't want these periods because these are not regular period, normal periods. They are called withdrawal bleed. They are called this withdrawal bleed. So sometimes athletes and some women who are in a difficult job like in police or in army, what they want? They want a long period of amenorrhea followed by a small period of pill then followed by this withdrawal bleeding. So this was achieved by sequential pills. They have a cycle of 90 days cycle. That means they have this withdrawal bleed every third month, and they were approved by FDA in 2002. Later in around 2007, this extended use, which was 365 days pill, low dose 365 days, regular, you do not have any period during the entire year. This was also approved by FDA. So this may be asked in your either in MCQ, or also this may be asked in your viva question. So you should be aware about this, that these sequential long term use pills are oral contraceptive in a low dose. They are used for a longer period to give this withdrawal bleeding every 3 to 4 months. Now how to start this? How to start this oral contraceptive pills? This is very important, because suppose a woman is coming to you on her 7th day of period, and she says, "Oh doctor, I want to use this COCs as contraceptive measure." Then what will you do? This is a very favorite question in viva. Examiner will ask you that what advice will you give. Although what is recommended, that OC pills should be started either on 2nd day, preferably up to 5th day of onset of menses. But in this case, what will you do? Will ask the woman to start this combined oral contraceptive pill also during the initial 7 to 15 days. We will ask the woman to use another contraceptive, preferably barrier method. And once she completes her first cycle, then she can continue her 2nd, 3rd and 4th and so on cycles without any problem. Because when she is coming on 7th day and you say ki okay, this cycle you cannot use, we cannot start this COC, but next cycle we will start. What happen? Either she may not turn up in the next cycle, or there could be a chance that she may become pregnant in this cycle only. So in this case, if a woman comes late to you, then you will start COCs and also advise another method of contraception for initial 15 days to avoid any chances of contraceptive failure. So this is a favorite question to be asked in viva, and you should be aware about it. Now newer concept is 24-day regime. This could be asked in your viva exam. What is a 24-day regime? Or it can come as an MCQ, that following OC pills are available for following days. They can give you 21 days, 24 and sequential and 365 and none of the above or all of the above. Then you will be giving the answer. You will understand that COCs are also available in a 24-day regime. What this 24-day regime, why it is selected? Earlier what happened, there was 7 days of pill free period. 7 days of pill free period. So ovary was uninhibited for 7 days, and this was related with the more of contraceptive failure. So this 24-day regime is important. In this we give oral this combined hormones for 24 days instead of 21 days, and pill free period is only 4 days as compared to 7 days. So this has achieved a better contraceptive benefit as compared to the 21-day regime. Now there could be a question that why we cannot use natural estrogens instead of this ethinyl estradiol in oral contraceptive pills. Nowadays 2 brands are available that contain this natural estrogen, that is 17-beta estradiol. But earlier when this was tried, what was observed, that this the cycle was not maintained and it was not very well tolerated because of the failure. So because of the further research, now this 17-beta estradiol is being used in a low dose in some OC pills. so that the side effects that are being caused because of this ethinyl estradiol, which is a synthetic derivative, is now very much less as compared to the previous ones. Now, a very favorite question of the examiner is also when he has picked up this oral contraceptive pill is that when is the ovulation expected to return when the pills are stopped, or when, up till when we will look for menstruation if we have stopped the use of this oral contraceptive pill. And this is also important question not only from the examiner point of view but also in general practice, because a woman may come to you after stopping the oral contraceptive pill she is using, and if she has not got her menstruation, up till what time is considered normal, and if she crosses that time then it should be investigated. So what is the limit? So ovulation usually comes in 1 month post stopping the pill, and menstruation usually returns in almost all 99% women in 3 months. So if a woman stops her OC pills, she comes to you after 2 months and says that my periods are not yet resumed, doctor, what to do? Then you will send her back, explain her that you have to wait till 3 months of the stopping of the OC pills. This, if you know this, then you are definitely reducing the burden on the investigation, and also you can calm the woman, you can relieve her anxiety by telling her this information. Now, next question of the examiner is what are the advantages of this combined hormonal oral contraceptive pills. So, first advantage that it inhibits the fertility. It reduces the fertility. It is used as a contraceptive. Yes, it is, and the Pearl index is also very low. It has got a very good protective action. Efficiency is very good. Now, what other advantages examiner wants to listen, because the withdrawal bleed that occurs while taking these medicines is less as compared to the normal menses. So we protect the woman against anemia also, because it can be used. What are the non-contraceptive use of oral contraceptive pills? This is another question which is, so in cases of regularization of menses, in cases of polycystic ovarian syndrome, also in cases of simple ovarian cyst less than 7 centimeter size. So all these are the non-hormonal, non-contraceptive benefit. What else? This when a woman is using this combined hormonal oral contraceptive pill, it protects her against this ovarian carcinoma as well as against endometrial carcinoma. Incidence of ectopic pregnancy is less because there is no ovulation along with the oral contraceptive pills. What else? What advantages are there? The pelvic inflammatory diseases is less as compared to the if the woman is not using anything. But if the examiner asks you which is better as for prevention of pelvic inflammatory disease, barrier or OC pill, then the answer is barrier method. But the effect of prevention of this pelvic inflammatory disease, although there is effect on prevention, but it is not as good as barrier contraceptive. What advantages? What other advantages? It reduces the incidence of benign breast disease. So these are some of the, and also it prevents against anorectal carcinoma. It prevents the progression of rheumatic arthritis. So these are the advantages of combined hormonal contraceptives. Now examiner will ask you what are the side effects of this combined oral contraceptive pills. So side effects are, there may be intermenstrual spotting, there may be nausea, vomiting associated with it, it may aggravate the migraine. So these are the side effects because of which a woman may leave the use of these medicines. So you have to tell her that this nausea, vomiting, all these side effects, they usually subside by 6 months of the use. And this intermenstrual bleeding which is occurring sometimes because of this medicine, you have to tell her that she has to be very regular in taking the medicine, because if she skips her medicine then she is more likely to get this withdrawal, intermenstrual spotting or bleeding per vaginum. So these are the side effects. Now what are the disadvantages that we use? If a woman is having migraine, it may be aggravated. In case if she is having migraine, it is even a contraindication, because then these oral pills may predispose her to stroke. Now what else? What is the most dreaded complication? Is the vascular thromboembolism. This is seen especially if the woman is high risk, if she is above 35 years of age, if she is a smoker, and if she is hypertensive, or if she has undergone surgery recently, or she is a case of systemic lupus erythematosus or coagulation disorders. So this is a real threat which is to be kept in mind whenever we are prescribing this medicine. But it is also there to be noted that although this VTE phenomena are high, but still the rate of complications, they are less if a woman does not use any contraceptive. So these are the side effects, and this thromboembolism is to be kept in mind. And what are the then contraindications? What contraindications? If a woman is pregnant, you will not give her. If she has a case of bleeding per vaginal which is not yet diagnosed the cause, then if she is a case of previous case of breast carcinoma, you will not be giving her this medicine. If she is active liver disease, you will not be giving her. If she is this migraine smoker, then you will not be giving her. So these are the contraindications. If she is breastfeeding initial 6 months, then you will not be giving her. Lactation is contraindication. Gallbladder function is if hampered, then you will not be giving. If she is having hypertension or uncontrolled hypertension or diabetes, then she is a contraindication. So these are the contraindication of combined hormonal contraceptive. Now examiner will ask you, definitely ask you, or it may come as a question in your written exam, that what is the mechanism of combined hormonal contraceptive. So because estrogen and progesterone, they both are present, it inhibits the FSH surge that is occurring in the follicular phase. That rise in FSH is not observed. Also the LH surge that occurs is not observed. So it prevents ovulation. So first mechanism of action, there is not only one mechanism of action, there are many. First is it prevents ovulation. What other? The cervical mucus, because of the presence of this progesterone, cervical mucus becomes thick and impermeable to the sperms which are present. They also become impermeable to some of the bacteria, so that's why it also reduces the chances of pelvic inflammatory disease. But this COCs, they do not give protection against gonorrhea or chlamydia or even bacterial vaginosis and also candida. So cervical mucus. Then alteration of the endometrium. Endometrium is out of phase, so implantation is also inhibited with the use of this oral contraceptive pills. Also it reduces the motility of fallopian tubes, and the transfer of ovum and sperm both are hampered. So these are the 4 mechanisms of action that you should be able to answer when you are asked about this question in your exam. Now the last thing, that if your viva is going very nice, then these two questions you may come across. If you are postgraduate, then an examiner may ask you, what is the relationship? Does this use of COCs increase the chances of breast carcinoma? So it has been seen by studies that no, it does not predispose a woman to breast carcinoma. Number 1. There are some incidences that cervical carcinoma is increased with the use of this combined oral contraceptive pills. Also this may be biased because of the contraceptive benefit. A woman may come in intercourse with many men, which predisposes her to this cervical carcinoma. So for if a woman says that she is in a she has multiple partners, then even if she is using this oral contraceptive pills, then you should suggest her, being the medical advice, that she should also use the barrier method of contraception to prevent the sexually transmitted diseases. So this was all about the combined hormonal contraceptive. I have tried to cover all the questions that are asked in the viva and also in theory and MCQs. So if you have any query, do write in the comment box. I will be happy to reply.